Coronavirus knows no bounds. 1 year into the pandemic, long-term care facilities have been no exception. Good Morning Iowa anchor Jackie Schmelin shares her story tonight. Then, the pandemic brought Iowans from all backgrounds to keep us safe.
I've seen a lot of things, but I've never seen anything like this.
And county health departments share the scary moments of trying to keep their communities safe.
It was widespread, it had deadly consequences, and that, it was going to be around for a while.
Coronavirus Cause and Effect, Iowa Impact, Episode 4.
Long-term care facilities are safe havens for elder Iowans. They can be places for folks to flourish and for families to feel confident their loved one is cared for. In 2020, they were also spaces for large coronavirus outbreaks. Local 5's Jackie Schmelin travels up to northern Iowa, sharing how one facility battled an invisible enemy.
Today, we're taking a look back over the course of the past year as it relates to the pandemic and long-term care facilities and how that looks for the residents, the staff, and family members who just want to see their loved ones again.
Is that okay?
In the middle of the pandemic, Karen Stubbe went from being a full-time caretaker for her father, Benny, to having to make the tough choice of admitting him to long-term care at Grand Javante in Hardin County.
Handing him over at the door, giving him his last hug, not knowing, am I going to be able to see him? Am I going to be able to visit him?
Then, in October, a COVID outbreak occurred in the Grand Javante building.
Is he going to get it today, tomorrow, or is he going to be one of the lucky ones that don't?
The outbreak was eventually contained, but Benny did end up contracting COVID.
Many days laying in my bed crying, feeling like I let him down.
There are many instances around the state of community and families getting creative during COVID. At Grand Javante, they saw parades, multiple signs, even food dropped off daily.
We had a husband-wife scenario that he was a big fan of strawberry milkshakes, and she would bring him strawberry milkshakes quite often.
Looking from the inside out, Gail is a resident at Grand Javante who struggled with the regulations in place during the height of the pandemic.
We all just got real, when we were quarantined all the time, it got to be tough on everybody. And I finally got to realize it was a real thing,
A big realization for Gail was when she found out her own mother was dying of COVID in the hospital.
And you never got to say goodbye?
No. Not really, because we thought she was getting better. And my brother called, he said, I hate to make this call. And that's what it was, so.
Now that restrictions are being lifted, residents can eat together once again and do activities. Gail is looking forward to getting back outside in the garden to plant tulips in honor of her mother.
I told my kids, I said, Grandma lived until she died. She did. She lived every minute of it, so that's good.
A year now into COVID and working with CDC regulations, Grand Javante allows supervised in-person visits. They are able to see one another in a regulated room. And Karen couldn't be happier to spend time with her father once again.
We want you to see your families. We want you to be able to hug them. It really does come down to patience. We are following guidelines. We are following them the minute they come out. We just got to wait for them to come out.
A year into the pandemic, we're learning that assisted living locations across the state of Iowa right now need to make decisions that are best for them. So for individuals like me who have a grandma in assisted living, we just have to learn to pack our patience, grab our signs, and say, I love you through the glass.
Contact tracing, that is a term all of us became very familiar with in the first few months of the pandemic. First, county public health departments and the state were making the calls to Iowans who tested positive, gathering their information. Then the Iowa National Guard stepped in to carry some of the load. Local 5's Sarah Beckman shares the story behind a hidden hero of the pandemic.
I do transportation, anything from moving pieces or people anywhere in the world.
That's Dave Letexier. He's a senior master sergeant in the Air National Guard stationed in western Iowa. At the beginning of the pandemic, Letexier focused his efforts on logistics, moving supplies from one part of the state to the other. But as COVID spread, his role shifted.
I was the NCOIC of the call center.
Letexier was in charge of setting up a system for contact tracing, and what seemed like a daunting task turned out to be one of the most rewarding experiences of his career.
I've been in a long time. I'm fairly gray and thin in hair. And I'll tell you that I've seen a lot of things, but I've never seen anything like this. You throw 50 people into a room and say, here's your mission. And you just go from there with really not much guidance. We came together very quickly.
Both the Army and Air National Guard made thousands of phone calls.
We would make these calls and we'd be filling out a spreadsheet that was about a mile long and trying to, for one, not be a robot. We wanted to be, real human about this, but we needed to take down data. And so we could stop that virus from spreading. We needed to get to the next person that they've been in contact with. And so that was a big part of our job.
One call in particular stands out to Letexier. It involved a Spanish-speaking Iowa woman who was having a hard time.
And our member talked to the interpreter to make sure she was okay, and she said she wasn't. Through the interpreter, we ended up calling 911 out to a county on the other side of the state, and the medics showed up, and she was about to have a heart attack.
Letexier saw the whole process come full circle too, visiting a Test Iowa site where some of the folks he called would get tested.
Going out there and seeing what our folks were doing in the weather, didn't matter what the weather was, they were out there. That was really, really nice to see.
For the last year, Letexier managed to stay positive and calm, and is looking on the bright side.
It might look ugly, but people are going to go get closer with each other because it was becoming obvious of that. And then we're going to have to learn how to get along a little bit more too in confined spaces, which I think overall helps us, as a humanity.
Sarah Beckman, Local 5 News, Weir, Iowa.
Outbreaks at long-term care facilities began to surface in the very first few weeks of the pandemic. The locations were locked out from visitors. The virus found its way in, taking so many lives. Local 5's Holly Schusselman shares the numbers that paint an alarming picture.
Those living in long-term care facilities are our most vulnerable population. The state has said that from the start. Let's take a look back at how reporting has changed over the last year.
Let's get to the basics. An outbreak at a long-term care facility is defined as 3 individuals testing positive within 14 days of each other. At the start of the pandemic, the state only reported residents. Now it's residents and staff.
And so recognizing that setting as an important setting for us to understand and for everybody to understand, and to be able to keep track of is really important. And that's going to continue to be important, again, not just for COVID, but for a variety of other illnesses.
One consistency on the state's dashboard is the active data. So current outbreaks, positives, and recoveries are based on current COVID activity, but death data are a running total. Dr. Padati says this data is reflective of the community where the facility is.
Bringing in things like, both the employees and the residents of settings like that are higher risk, and sharing that information to help people understand how that can be affected by community level activity is an important piece of this puzzle.
Over the pandemic, 337 facilities out of the state's 432 have reported an outbreak at least once. The state health department says Polk, Blackhawk, and Lynn counties have reported the most outbreaks. As of March 8th, 2,193 residents have died from COVID.
A lot of the data dumps, specifically for deaths, can be attributed to long-term care facilities. The last death reporting update included mostly resident deaths. Reporting in the studio, Holly Schusselman, Local 5 News, We Are Iowa.
A unique look at the pandemic's toll on care facilities through the perspective of one of our own. We We are continuing our profile of the families of long-term care residents battling loneliness, confusion, and illness during the pandemic. One of those stories hits close to home for us. Good Morning Iowa anchor Jackie Schmelin shares her story.
On June 9th, 2020, 3 months past Iowa's first identified COVID case, it was decided that my grandmother needed a higher level of assistance in long-term care, including hospice, and she was admitted to Acura Healthcare of Aurelia in northwest Iowa. From the moment she entered the building, she was put into quarantine, and we couldn't see her because they were already in lockdown, and we struggled to explain to her that this was her new home. My grandmother turned 103 this past December, and because of her age, she doesn't hear well, and she is of the generation where technology like a cell phone or an iPad held up to her just doesn't make sense. We've quickly learned that when words don't work, posters and smiles are enough to do the trick for now. The staff at Acura Healthcare have gone above and beyond, making sure she is safe and always guiding her to the large front window so we can say hi. They have recently allowed one visitor to make contact with my grandmother, and that is my dog, Jack Jack, who is able to share our love. Like other long-term care facilities in the state, they are now scheduling supervised visits, but you are not able to get close to your loved ones. And with my grandmother's hearing issues and confusion of the current situation, we continue, at this time, to make our visits through the glass.
Boy, this has been a hard year, Jackie. Thank you for sharing your story. First of all, we know this was very personal for you, but we do have some good news. Your grandmother has received the COVID-19 vaccine. So what are you most hopeful for in the future?
So the concept of seeing my grandmother again, being in person, being able to hug her one last time, tell her, I love you one last time, thank you for everything you've done for us, didn't seem like a reality last year when she went into hospice care. But now that the vaccines are rolling out and things are improving and her health, I'm happy to say, is stabilized, the idea of being able to see my grandma in person and hold her is now becoming a reality once again. It's kind of a glimmer of hope down a very long and dark tunnel. But in the meantime, Stephanie, this is still my reality at this time.
It's hard. It's been a hard year, Jackie. We're thinking about you and pulling for you and Grandma, and we can't wait to see that picture of you two together.
Me too. Thank you.
Thanks for sharing your story again. During the pandemic, we all learned a lot about health, safety, and the importance of our local health departments. So joining us now is the director of the largest county health department, Polk County's Helen Eddy. Helen, thank you for joining us.
Well, thank you for the opportunity. I appreciate it.
Well, first, let's go back to March and April when the pandemic began here in Iowa. What was it like coordinating a response for that?
Well, we actually started planning here in Polk County back in January. So by the time March arrived, we had already been at it for 2 months. And I would say that we were monitoring this very closely. And it's really kind of hard to wait for that, as I say, that shoe to drop. We're waiting for that first case to actually be identified in Polk County. And it finally was on March 15th. And so that felt like a really kind of momentous event to us.
And what were some of the biggest challenges that you faced during that initial early time?
I think it was a lot of the unknowns, you know, just not knowing how widespread this was going to be, how severe it was going to be, how deadly it may or may not be. And unfortunately, it turned out to be all of those things as we progressed through it, that it was widespread, it had deadly consequences, and that, you know, it was going to be around for a while.
And what have you learned throughout the last year about the county's response to COVID-19?
Well, I think the biggest thing that I have learned, and it's been so rewarding, has been how willing everyone in our community has been to step up and to help. This is not something that just a single local public health department with 42 employees can do by itself. It really is a community-wide effort, and we are so thankful for everyone's willingness to step up and serve.
You know, in hindsight is 2020, so anything that you would change to the county's approach to coronavirus?
I think our change has been really strong. I think the biggest thing that I would change maybe would be the misinformation that's out there. How do we get people to trusted sources, the right information, not some of the misinformation that we see on social media? So if you have any answers for me on how to combat that, we'll take them.
Well, Helen, we thank you so much for the work you're doing to keep all of us safe and healthy over the past year plus. We thank you for your time tonight.
Well, thank you.
Throughout the pandemic, we asked you to send photos and videos of things that made you smile each day. Sometimes it was something big, like a birthday parade, or something small, like a beautiful flower you saw on a walk. But mostly, it was your pets. And looking back, it turns out animals are the real VPs of the home quarantine. They're the wagging tails and sweet faces that welcome us home every day. So when we were stuck at home, our pets were right there by our sides. They were silly, they were comforting, they even took up space in the home office, a constant in a world that seemed to be spiraling out of control.
When things get really bad, there's nothing like the purr of a cat or the snuggle of a dog or guinea pig or horse or whatever species that you choose to turn your spirits around.
No surprise, people stuck at home turned to shelters to add a pet into their lives. The ARL saw a huge spike in adoptions, people looking to add a little joy into their lives. But they also took in fewer strays, which led to another pandemic silver lining.
So we've actually even been able to help other shelters around the state and around the country who are full bring in animals because we have more people wanting to adopt than sometimes we have animals available. So we're trying to keep animals available for people who want to bring them into their homes, which is a great problem for us to have.
And when these days are behind us and we go back to whatever normal may be, let us remember the joy, the comfort, the peace that our beloved family members, our pets, so graciously gave, and do our best to return the favor.
Tomorrow night on Local 5 News.
It shows intent and it shows a lack of regard for people. The one was lying or asking interpreters to mislead employees.
And we've learned a lot about the coronavirus and how to deal with it and how to stay healthy. And that's a huge asset.
Coronavirus Cause and Effect, Iowa Impact, Episode 5 starts tomorrow at 6 on Local 5.
And we'll see you at 10.